Hi, I'm Jennifer, lifestyle educator at Genesis Health Institute.
And hi, my name is Dr. Ferdinand Cabrera. I am the medical director of Genesis Health Institute.
And we're here today to talk about some of the signs and symptoms of pre or perimenopause and how Genesis Health Institute can help alleviate those symptoms. Dr. Cabrera, what can you tell us about perimenopause?
Yes. Well, perimenopause is one of the most untreated conditions in our American society. It usually starts between 35 and 45 and is also triggered by stress. Poor dieting, lack of exercise. The most common cause for this perimenopause is lack of progesterone. We see this more commonly in women that are using in vitro fertility or are using fertility treatments because they're having children later in life. So this causes the ovary to produce an exorbitant amount of hormones or ovulation, and that decreases your production of progesterone in later years.
What are some of the symptoms that a lot of patients that we treat, what do they come in with mostly?
They come basically complaining of weight gain and also lack of libido. They feel unrested. They are tired or they are wired, and they have gone, they have gone to other doctors and clinics, and everybody tells them that they're okay. So a lot of them come here being treated with antidepressants. Can you imagine being treated with an antidepressant for symptoms that can be easily treated with a hormone that your body is not making? So those are the most common symptoms. Patients stop losing weight, start gaining the weight in the abdominal area. They also say, well, I do yoga, I do my Pilates, and I'm not able to lose any weight. What's going on with me? I eat well. Actually, the most common thing is that women in that perimenopausal, they undereat. So if you're not eating properly the right amount of calories and protein, all my petite patients eat just a lot of carbs, no protein. And they have a salad, they have a sushi, but no protein. So that's part of what put all your system under stress. And when your body start making stress hormones, cortisol shoots up, and there's no way that you can lose weight in that scenario.
It's true.
That is plain perimenopause. So you have seen that here.
Yes, I have. And what kind of treatments do we do here at Genesis to help women with these symptoms?
Yes. Well, here we treat the whole body as a complete unity.
Right.
So we do an assessment for the metabolic functions, hormone balance, and nutrition. And after all that data, if I receive that data, then you know that we create a roadmap to treat them individually. Most of these patients still their body can jumpstart their own function, and they can have amazing results by just doing fine-tuning in their eating, their sleep, and their diets.
And one thing that I really like about Genesis, and having been a patient here myself, is that you are always tracking people, monitoring their hormone levels as you're giving them different therapies to be sure you're optimizing the plan for them. It's not just a cookie cutter approach. It's
Absolutely.
Very specific for each patient.
Absolutely. Each patient has their own individual markers, and each patient has their own individual lifestyles and needs. So the idea to make initial assessment and have the patients go home with the program and don't see that patient for 6 months is absurd. So you know that initially we see the patient, after the treatment is started, we see them in 4 weeks, and after that, every 3 months, we touch base with these patients, and I'll continue modifying their treatment or adding or subtracting things. So the therapy is very individualized. We have the InBody, which help us a lot determine the lean muscle mass, the body fat percent, how many calories that patient is going to eat. And also for our prior patients that have gone to perimenopause, then we hold them to the process before they get to menopause. So those patients have a better change in their hormones because they are supported through all the time, and they don't experience the full-blown effects of menopause, like hot flashes and so far and so forth. A lot of our patients that have been with us for 8-10 years, they never experience menopause. because they have been supported all this time with the hormones, the nutrition. Another thing that is worth to mention is that we add intravenous nutrients. As you know, patients in perimenopause are fatigued, so the adrenal glands are compromised. By adding a mix of nutrients like vitamin C, calcium, magnesium, all that administered intravenously, we optimize the absorption of the nutrients and translating in a perfect metabolism and function of our system.
And I know one of my favorite IVs is the Beautify, which, we add biotin, selenium,
Yes.
zinc, which helps with the hair, skin, nails, which as women enter pre-menopause or perimenopause, there can be hair loss, the skin can become saggy and dry, and the nails brittle. So this really helps treat those symptoms as well through IV nutrition.
Yes. Me myself, I don't have hair, but I use the Beautify almost every week for the skin. As we age, our skin becomes very deficient. We can absorb zinc, biotin, or selenium. So it's added to the IV bag, and that translates in your skin being full, being radiant, and you feel amazing when we use these treatments.
All right, so thanks for chatting with me today.
Absolutely,
I always learn a
Jennifer.
lot when
Yes.
I'm talking to you, and we
Yes.
hope to see you here at Genesis Health Institute.
Absolutely. We want to see you. Come and see us. Thank you.